My name is Leanne. And like Tim said, I am a psychologist at Nemours. I primarily work with children and adolescents and their families. So, table of contents, what I'm going to cover today. So, basically, some introductions about me, what I do, and then what are some of the options for mental health careers? There's lots of different ones at the undergraduate level or bachelor's level, master's level, doctorate level. Um, and then zeroing in on mental health and medicine because this is the mini med school, so I think you'll probably be most interested in the careers in the medical field or adjacent to it, and then leaving some time at the end to answer any of your questions if you have any of those. So, about me and my journey to become a psychologist. This is me with my mom. I'm a baby. Um, and and some of my identities that I think are core for me, and I think is important to think about even as a professional, is like who I am and how does that inform what I want to do with my life. I'm a Chinese immigrant. I'm a naturalized American citizen. I'm a Delawarean. I went to Concord High School. Graduated in 2006. And so if any of you are Delawareans, if any of you go to Concord, amazing, love it. I'm a woman in STEM. I've always been interested in science, psychology, social sciences. All of that is also a part of STEM. My training, as Tim already said, I got my PhD at Lehigh, and then I have a master's from UPenn in counseling. And then I went to University of Michigan for my undergrad. So if any of you are curious about any of that, I studied biology and psychology double major at Michigan. And then currently, I am a child psychologist in outpatient therapy, and we'll talk more about what that means, outpatient versus inpatient. But basically, I see people once a week, approximately, usually for individual therapy and sometimes family therapy. I mostly work with teenagers and sometimes children, 11 or 12. Um, and I also teach. So I teach people at the doctorate level and the master's level to help them with their training, learning how to be therapists, learning how to do assessments, things like that. Um, Teaching them about best practices when it comes to mental health. And then I also do research, and that's something that I'm also really interested in too. And that's something that I love about my role at Nemours is that I get to do lots of different things. And this is another thing, maybe when you're thinking about your career, is that I'm someone who needs to do a lot of different things. I get really bored if I am just doing just therapy all week, every day. I will get super duper bored. But what I love about my role at Nemours is that I can do a little bit of everything, teaching, clinical work, so doing therapy, and then also training other people, as well as hopefully carving out a space for research for myself as well. Specializations. So I specialize in the treatment of trauma, people who have been through adverse experiences, abuse, neglect, um, major accidents, loss of family members, severe mental health disorders. So things like suicidal ideation, self-harm, depression, anxiety, bipolar disorder, psychotic features, so seeing and hearing things, dissociation, and also high-risk behaviors like the things I just said. So thoughts of wanting to die, self-harm, that kind of stuff. I've worked in a lot of different settings. So if you have a question about a type of setting, I've probably been there. Schools, hospitals, inpatient, outpatient, private practice, community mental health, a lot of different things. And I've trained in many different types of therapies, evidence-based therapies, and I've worked with patients across the lifespan. My favorite is teenagers. I think teenagers are the coolest. But I've also worked with really little kids, and worked with older adults, like people over 60. So across the lifespan. The only thing I haven't really done is couples therapy. So probably missed the boat on that one, but. What did I want to be when I grew up? So I actually wanted to be a psychologist. I remember reading a book about a psychologist and watching, so Law and Order SVU, BD Wong was like one of my inspirations. And I thought this is really cool and I really want to do this. And I think it's so interesting learning about other people and how their brains work. I originally double majored in biology and psychology because my Asian immigrant parents were like, "What is mental health? Why would you do a career in that?" And I was like, I guess I'll also do bio so that like you feel good about that." And so when I say like cultural influences on my career decisions, I do think that my parents came here. They're scientists. They work in research, biomedical research, and I think they had a lot of knowledge about what worked for them, what worked for other people, and so wanting to take their advice and respecting their knowledge, but then also knowing that I had to carve my own path and do what I wanted, even if it's something that they're not familiar with. My experience with my community and culture is that mental health wasn't always understood or talked about, and so they didn't always understand like that you could make a career in it. And now it's so different. And I think it's really interesting is that now that I'm a psychologist, my mom, her friends, they all ask like, "Oh, wow, like should we talk to our kids about this? Like, what do you think?" And it's been really rewarding to be able to bring more awareness to them. And then this butterfly effect, ripple effect of them then bringing that awareness to their friends and everybody across their community to talk more about mental health and why actually like this is valid and important and maybe go to therapy. Maybe all of you should go to therapy. Um, it's always been a passion of mine. I did a stint considering medical school, applied to some schools, didn't get in. I think that was the universe telling me like that's not what you wanted to do. So it all ended up working out. So actually, my story is a story of failure. I applied for medical school, I didn't get in. I applied for PhD programs, did not get in the first time, only got in the second time. But if it's something you want and you care about, then you'll keep doing it. If you do it, you fail, and you're like, well, forget it, then maybe it wasn't a passion for you anyway, and that's okay. And maybe there's something else that makes sense for you. I think it's important to challenge yourself to learn from your failure rather than letting it crush you. And that's what it did for me is knowing like, I think I'm learning from this failure to realize like maybe this isn't the path that I wanted. And I'm really thankful for it because I think I'm a lot happier as a psychologist than I would have been as a psychiatrist, if I'm being honest. Um, Being in my doctoral program and also my master's program helped me realize I really love research. I did a lot of research in undergrad. I worked for 4 years um, as a researcher at DuPont Pioneer, actually, in plant biology. So I always loved research, and I'm glad that it's still a part of my life. I love learning, so that's why I spent about 1,000 years in school. And I always want to keep learning. I think that's one of the coolest things about my field as well, and any medical field, is that you're encouraged to continue learning. In fact, like to renew your license, you have to keep learning all the time, which is very cool. Um, so my timeline to becoming a psychologist, I think it's important to highlight this because everyone's going to have a different timeline, and that's okay. I finished my undergrad in 2010 from the University of Michigan, and I did not go back to school until 2014. So there was 4 years in between there where I was kind of like doing this working thing. Maybe I'll go to med school. Maybe I'll apply. Just kidding. Probably I'm not getting into med school. Well, I did always want to be a therapist or psychologist or something. And I heard you could get a master's degree in counseling, so maybe I'll do that. So then in 2014, I went and got a master's in counseling from the University of Pennsylvania, graduated in 2016. And by that point, I had gathered the experience and knowledge to know that, like, okay, I want to go all the way. I want to get that PhD. So then I reapplied, started my PhD program in 2017, graduated in 2022 from Lehigh University in counseling psychology. That postdoc period, I think that's something to really think about. Do you want to go straight from undergrad into your doctor, like into a medical program, into medical school or nursing school or a PhD program or whatever it is you end up doing? Or do you want to take a break? And that's okay if you did. Because I'm so thankful I took a break. Going back to my master's in 2014, a few years older, I was so much more plugged in. I was ready to learn. I was excited to learn. Everything I was learning was really cool. I was like, it was work, but it was fun work because I enjoyed learning it. Versus, I think some of my observations of people who went straight into the master's degree right from undergrad, they were so burned out from school because they already just did 4 years of it. And it was probably super hard and super tiring. And I was really thankful for the years I had. Learning about myself and my learning style and getting a real job and making money and learning about how to be a professional in a career before I then went back to school because I felt so much more confident in what I wanted and what I wanted to be. So what are some options for careers in mental health? There's actually a lot of them. Um, so There are degrees that span from a bachelor's, even an associate's degree. There are even things you can do out of high school for some of them, to the graduate level. So a medical degree, like as a medical doctor, MD or DO, PhD, PsyD, things that we'll talk about there. As a PA or a nurse, there's lots of options, and mental health workers can occupy a lot of different settings. So medical settings, corporate settings. So people, especially in psychology, something called IO, industrial and operations psychology, they consult a lot on to corporations on how to manage people and structure workplaces. So consultation, you people, psychologists consult in schools, psychologists consult like at Nemours, we hire outside psychologists to consult with us when it comes to team building and building rapport or examining if something's not working on our team. And then we might consult with an outside psychologist to provide some trainings. Research psychologists, uh, I'll speak for psychologists because I will be saying talking more about psychologists because I am one. But if you have questions about the other fields, I absolutely can answer that too. But um, psychologists in particular are uniquely trained to do research because we have to do a whole dissertation. We take multiple classes on research methodology. So there's a lot of things that we're well equipped to do research in, but that also means our clinical work is really research informed, which is really important. Um, Education, so teaching, um, at the doctorate level, at the master's level, at the undergraduate level, training, like currently what I do, which is training up and coming psychologists on how to give therapy, how to do testing, all of that stuff. And of course, the traditional thought of clinical work. So doing therapy, giving tests. When I say tests and evaluations, that includes things like IEP testing. So if any of you are familiar with that, or if you have an IEP, that's to help people who maybe have a difference in their learning or a difference in their attention, or maybe have some mental health or other things that require additional support in school. And so we'll do a battery of tests to evaluate how you're learning, how you problem solve, any mental health stuff, any other things like ADHD features, autism, to determine what kind of accommodations might be necessary. Neuropsychological testing includes other things as well to look at. A really great example of this is if you suspect your family member may have dementia. Of course, you can get an MRI, you can do these other things, but there's also neuropsychological testing to look at how your brain is functioning, how it's learning. Are there any weird issues with like how the brain is functioning, memory, processing speed, all of that stuff that really helps diagnose what exactly is going on and how we can help. Um, so there's lots of really different and interesting testing that psychologists get to do. And that is another one that is very unique to psychology itself. Um, and of course, you can work with people across the lifespan. So babies, like you can do therapy with babies. We have a clinic at Nemours. It's the ABC clinic, and it's specifically for much younger children, toddlers and babies. And then you can also work with younger children, adolescents, young adults. All colleges typically have a college counseling center, and that's staffed by master's level therapists and counselors as well as doctoral level PhD, PsyD psychologists. So you can work with college students. You can also work with older adults, middle-aged adults. It's across all different sorts of presenting issues, medical, mental health, otherwise. If you want to work with specific demographics, like some people specialize in autism and specific diagnoses. Some people mostly work with women who've experienced trauma. There's lots of different options. So here's a look at careers at every degree. So at the bachelor's level, and I will say, when we say bachelor's level, this could also be, so the mental health technician, there are some jobs that they might say at least a minimum of an undergrad, but associates or bachelor's is encouraged. I say this because sometimes people are interested in experience before maybe they decide to invest in a medical school degree, which is a long time of training, or going into a master's or a doctorate school. And so they want some experience. And so there are some options if you have an undergraduate degree in psychology to dip your feet into what it would be like working in the mental health field. I will say being a mental health technician is challenging. It's really tough. So you can work in behavioral or psychiatric, basically, essentially helping support in providing mental health services. So you wouldn't be the one providing the therapy, but you may help reinforce the therapy. Like if the therapist said, hey, and this is, for example, I worked at the Terry Children's Center, which is an inpatient facility in Delaware for children and adolescents, and our mental health technicians were extremely important with helping the treatment plan that I had implemented for my patients. So if I said, hey, like, we're working on managing our anger. And if my patient gets upset, then we talked about that fact that she would try this breathing technique or she would go and like do these like three strategies. And so here they are. And so now when she is with you on the unit watching TV or at lunch or in the classroom, and she starts getting frustrated or she starts pacing, and that's how you know she's about to like get a little bit upset, can you help reinforce by doing this with her? And then you, like a lot of times they coach, or they might have a more closer relationship sometimes than I do because they see them every day, every hour, all the time, following them around because the kids live there. And so you really get a chance to get to know them, help with reinforcing those therapy skills, doing a lot of that coaching stuff. And it can be really rewarding and cool. You might see some like interesting stuff too. Applied behavioral analysis typically is specific to autism treatment. ABA is an autism treatment. But there's the people who are certified in ABA who are doing the ABA therapy. And then there are the behavioral technicians who, again, are reinforcing the skills that they're learning in ABA. Research coordinators. So we have people at Nemours even on the undergraduate level with a bachelor's degree or sometimes with a master's in psychology who are helping to coordinate research. They are helping with recruiting. They're helping with manuscripts. They are helping with grant writing. They are helping with setting up the lab. This is a really great opportunity for people who are really interested in going into a doctor program or going into a medical program to get the experience on the resumes that makes them an attractive candidate. Sometimes there's room for publications and presentations at conferences, which is a great opportunity to network, to get to know other professionals, and while still being able to make money off your degree. At the master's level, this is where then you can get these certifications and licenses. So lots and lots of options. Psychology technicians. So we do testing, psychological testing at Nemours, as I described earlier. And so the psychologist may not do all of that testing by themselves. They may have a psychology technician who helps do some of the testing, like the cognitive testing or some of the achievement testing. And so that person has to have a master's degree at minimum, but they get to do some of that stuff, which is really cool. And they might help with some of the report writing. Um, Applied behavior analyst, so that's the ABA, but this is the certified person who's doing the therapy. Again, this is usually specific to autism treatment. So if you're really interested in autism stuff, like that's a route that you can go in, and you don't have to have a doctor to do it. You could be at the master's level and do that therapy. Clinical social workers. So these next three, licensed clinical social workers, marriage and family therapists, and then licensed mental health counselors, they can kind of essentially do the same thing, but the way that their profession approaches therapy might differ. For example, someone who does therapy from a social work perspective is thinking about the whole system a lot more. They're thinking about like, how is this person influenced by the resources that they have, and how are they influenced by their background? Marriage and family therapists are probably thinking about things from the family system or the couple system. So like, okay, it's not just the kid, it's also their parents, it's maybe their grandparents who also is active in their lives. And how do we do therapy in a way that includes this entire system of people, versus a mental health counselor? While they can also do family therapy, they can also do couples therapy. Maybe they're thinking more about the individual, they're more thinking about like individual factors along with maybe some other things. So the end goal of being a licensed master's therapist, you can essentially do the same thing in any of these three things, but different people pick these different careers, or tracks because something about that particular field and the way they do therapy speaks to them. Um, Psychiatric nurse practitioner. So that's at the bachelor's level, you could be a registered nurse, and then at the master's level, you can be a nurse practitioner. And the nurse practitioner has a lot more independence when it comes to prescribing, but they would still have to operate underneath of a physician. So they can't like independently open their own practice. They would still have to be licensed under a psychiatrist. Same with a psychiatric physician's assistant. Both of these are more master's level degrees, 2 years of training with additional a lot of rotations within settings, and you get to look at a lot of different types of fields, not just psychiatry. Um, so those are the two that allow you to prescribe medication. Currently, at least in Delaware, doctors, nurses, physician's assistants, those are the people that can prescribe psychotropic medication, meaning medications for anxiety, depression, ADHD, the things for managing bipolar disorder, schizophrenia, that sort of stuff. There's some movement around allowing psychologists to become able to prescribe, but that's not happening in Delaware currently. So if that's something you're interested in, is the more medical prescribing medications, like the biological connection, then you might be more interested in like psychiatry, psychiatric nurse practitioner, psychiatric physician's assistant. If you're more interested in delivering therapy, meeting like the traditional, I meet you for about an hour once a week talking, or inpatient where I'm meeting you maybe every day for 30 minutes, that kind of thing. Um, then you might want to do something like a social worker, marriage and family, or licensed mental health practitioner, or a psychologist. I know that in the media, there's a lot of people who are psychiatrists who also do therapy, but currently, most psychiatrists do not provide traditional therapy, like the every week I have a person who comes in and we talk about your issues and then we discuss like what types of strategies might be helpful. We talk about what feelings are going on in there. We talk about that stuff. That's not a thing that most psychiatrists do. Psychiatrists are prescribing medication and they might use therapeutic techniques to help gather information to make an appropriate diagnosis for the medication. And they will follow up with that person periodically once a month if the medication's stable, then maybe once every few months. But it is not that frequent traditional deprocessing therapy that you might see on TV or in the movies. That's traditionally now done by either a master's level therapist, like the social worker, family marriage therapist, or the licensed counselor, or a psychologist. So where are the settings that you can work? There are a lot of them. Hospitals, which is where I am. So you could do a children's hospital, an adult hospital. There's hospitals that are operating out of universities, like the University of Pennsylvania has Penn Health, which is connected to the hospital. CHOP also connected to UPenn. Um, and then you have outpatient, so that's more community-based, meaning that they're not connected to a medical system. If that person has an emergency, they would have to be evacuated out somewhere else. Um, Private practices. So some outpatient places are hospital-based. So like we do outpatient therapy, meaning they go home. That's essentially what that means. You meet me for an hour and then you can just go home, do whatever you want to do in your life. Versus inpatient, which is that other setting over here where you may not go home or you're there for the whole day and then you go home. Veterans health. So veterans hospitals, VA hospitals are a unique medical system in the United States that specifically provides um, medical health, mental health, social supports, social work supports, all sorts of things specifically to veterans. That is a benefit that they get from serving in one of the branches of our military. And so there are unique challenges, unique expertise that comes with working with our veterans and the families of the veterans. So the Veterans Health System is another one that psychologists, psychiatrists, mental health practitioners can operate within. And then, so the inpatient versus outpatient. So inpatient meaning traditionally people think of like, oh, like literally you're there 24/7 for several days, maybe a couple weeks max. So there's independently functioning psychiatric hospitals. Here we have Rockford, we have Meadowood. not Nemours, Terry Children's Center, or you have ones that are based within a hospital. Like Nemours has a emergency department, and sometimes they may keep you overnight or for a couple days for observation. So that's sometimes within a medical hospital. Some hospitals have their own psychiatry wing specifically for people who are staying there for a few days for stabilization. Um, and then emergency care. So Nemours has emergency care. We do not have a lot more long-term inpatient psychiatric facility. That's a outside facility like Rockford or Meadowood. Schools, so psychologists, nurses, master's level therapists also do work in schools, in the school system. And then at home. So some people will make house calls. Sometimes they have things like family-based family therapies where the therapist will come to the person's house and look at like how is this environment and what can we adjust to support the family in meeting their therapy goals. So let's take a closer look at what some mental health careers are in medicine specifically. So what I'm going to focus on like so the settings that actually include health stuff, medical stuff. So that's hospitals, veterans health, some outpatient, such as us, like what I work and where I work and do, we're in Nemours, but we are an outpatient clinic, and then inpatient. So let's start with veterans health. Um, so behavioral health is offered across the lifespan in veterans health from adults, young adults, all the way up until end of life. So that includes, totally losing the word, that includes hospice care. I have a coworker or someone I graduated with from my PhD program. She works with older adults in a veterans hospital, and her expertise is in end of life care, dementia, hospice care, that kind of thing, and specifically for veterans. Um, so this includes long-term care facilities, and people who are medically complex, like if you think about the intersection of mental health and medical health, something like dementia, Alzheimer's, that's like a disease that is right on that intersection of understanding how the brain is working or not working, and how is that also impacting the physical health across the board for an individual, and then how that's also affecting their mental health, the way that they think, the way that they're able to remember things or not remember things, the ways that they're interacting with their family. A lot of what she does is grief as well for helping support that veteran's family members who are having to grapple with the fact that I don't know who this person is. They've changed so much. They don't remember who I am. It can be a terminal illness. So like at that end of life hospice care, how do you support both the person who's being treated as well as the family? So a mental health practitioner does all of that. In addition to testing to see, is this Alzheimer's? Is this dementia? What is going on? Because this person isn't like remembering things the way they used to. They're forgetting stuff. They can't find their way back home, that kind of thing. Um, Outpatient treatment, of course, so that includes again that like you do an hour therapy and you go home. So they can treat across the board all sorts of things, PTSD, depression, substance use, schizophrenia, bipolar disorder, as well as things like traumatic brain injury. So we might think of a concussion as like a health issue, but actually it's something that requires particularly psychiatry, neurology, psychology to come in and do testing, evaluation, treatment to sit, like look and go, okay, was there permanent damage from this traumatic brain injury? Or are we good? Like you can go home, you'll heal, and it's going to be okay. And if there is permanent damage or like lasting damage that requires physical therapy or some kind of treatment, then your mental health professional can assess, especially a psychologist can do some testing, neuropsych testing specifically sexual trauma, TBIs, PTSD, substance use. These are things that you see a lot with veterans and that the treatment of can be really unique to this population with these particular issues. And they provide all sorts of modalities, group therapy, couples therapy, family therapy, individual. So They provide testing, like I said, medication management, so prescribing medications to help support with some of these issues that we talked about. Um, Another really cool thing, I think, if you're interested in psychiatry as a profession, is that you have to really understand how someone's depression medication is going to play with maybe their um, heart medication, their blood pressure medication, if they have diabetes, if they have a long-term illness and they have to take multiple medications to manage chronic pain. And now, what if I add something like depression medication, anxiety medication, a mood stabilizer to address some of my other things like schizophrenia, bipolar disorder, PTSD? How are they going to play well with each other or not? And how does the psychiatrist have to adjust the medication to make sure that it's not making this individual feel worse than they already do and is actually helping them and making sure that they're getting like feeling good and able to do the things they love. Um, and that could be really interesting and one of the cool parts about psychiatry. The veteran setting, like hospital settings, provides a diverse range of physical and mental health conditions to consider in treatment. And there's also research opportunities within veterans health. So there's a lot of really cool stuff in veterans health, if that's like a population that you're really interested in. And this is kind of the thing I mean is like, I think there's a lot of diversity in what you can do with a mental health degree and a mental health career. And there's lots of different populations people are passionate about. Some people are really passionate about the veterans population. So they want to work with veterans. And so there's a lot of opportunities to dive into that field. Inpatient care. So there's medical hospitals and then there's psychiatric hospitals. And people can work across the board. So emergency care, if you've talked about the different specialties within medicine as well, there's like emergency medicine versus family practice versus all of these things, the same with mental health. You could be doing crisis intervention in mental health, and that can, some people love it. And other people find it extremely stressful and will burn out very quickly. Figuring out where you want to focus is really about knowing yourself and what you love and what you tolerate, and will absolutely get burned out from. Emergency crisis is usually like that first 24 hours they're coming in. But then there's inpatient hospitalization. So they may be there for a few days, sometimes a couple of weeks. And so you're getting to know someone in the short term, but very well, versus something that I do. What I do is more, I get to know you in the long term very well, but only for an hour a week. Versus inpatient, like that person's there, like they're a captive audience. You could see them quite a few times. The focus is on stabilization and short-term care rather than outpatient therapy, which is more focused on long-term sustaining of progress. And that's a difference too. Some people really like that stabilization short-term therapy focus, and other people don't. They prefer something more long-term. That's why they go into more outpatient practice. Another part of that is stabilizing medication so that psychiatry comes in big when it comes to that stuff. Like if someone's coming in, their medication's not stable, they're having new symptoms, then it's really important to observe them for that long period of time. And the psychiatry team, nurse practitioner, PA, psychiatrist figure out like what's the best medication that stabilizes this person and allows them to leave here stabilized, functioning, doing the things they love, living their lives. Similar in psychiatric hospitals, but psychiatric hospitals might offer a lot more in relation to services. So partial hospital programs and intensive outpatient programs, these are more intense short-term therapy services where you don't have to live at the hospital, but you might be there all day doing therapy and then you go home, but you do it for like maybe 2 weeks versus traditional outpatient therapy. Maybe you only see that person for an hour every week, but you see them for 3 months, 6 months, a year, 2 years, depending on what your needs are. Again, the focus is still on stabilization. There is a unique type of psychiatric hospital or residential program called a residential program, and that's where people do go to live 4 months, like 3 to 6 months. So that's where that long-term care piece is. And again, I think I talk about all this so that you're aware of like, oh, do I want to do that kind of work where I'm somewhere where that person lives there and they live there for 3 to 6 months and I'm their therapist working with them across those 3 to 6 months? Because you can really get to know somebody if like I can't leave. I just live here. So you're just going to see me all the time. You see how I eat. You see how I go to school. You see how I interact with people when I'm just in the living room watching TV. When I was at Terry Children's Center, I worked with adolescents and children who were doing this type of 3 to 6 month long-term care program. And I really got to know them in a way that I wouldn't doing outpatient therapy. So that was really cool. So hospitals and hospital settings. So mental health providers work in a diversity of health setting and disciplines. So it's not just mental health diagnoses. At Nemours, we have psychologists across the board in a lot of different medical settings. We have people who specialize in diabetes care, oncology, hematology, neurology, urology, primary care, whatever you can think of, you can find a psychologist who specializes in it. Um, Nemours in particular is a pioneer in integrated primary care, meaning you have your PCP, your general practitioner, you go there for your checkups, but there's also a psychologist or a social worker or a master's level therapist or all three who do consultation. So if something's going on, and they need someone to come in and do like, hey, check in with this person for 30 minutes and see what additional stuff we need, they'll be there to talk with them and they have the expertise to talk about it in a way that's sensitive, that is appropriate, and that doesn't freak whoever it is out more than they might already be freaked out from answering some of those questions and disclosing some things that are quite sensitive and maybe hard to talk about. Um, what would a mental health professional do in neurology or diabetes or oncology? So there's a lot of different things. This might include treatment adherence. So I actually have a patient who recently got diagnosed with diabetes. And I think it's really hard sometimes to come to terms with a chronic illness that you're going to have for the rest of your life. How do I have to prick myself every day to multiple times a day to do this medication? How do I feel different about certain things? How do I deal with the fact that I might have certain things I have to like do differently in my lifestyle or habits. Same thing in oncology. So sometimes that's end of life and talking with families about death, and grief. Other times it's how do I just get through this day and this treatment, this particular round of chemo that has really been tough for me. Neurology, there that might include a lot of testing, and explaining of those results. So there's a lot of mental health stuff we don't think about that comes with having chronic illness, depression and anxiety, grief and loss, treatment adherence, providing long-term care. There's also brief consultation. So in inpatient hospital settings where maybe someone has been there for a couple of days for a recent cancer diagnosis, for a treatment, for a surgery, for whatever, then a psychologist, one of our psychologists might come in to briefly consult and answer any questions related to some of the treatments that they're receiving. And they might be better equipped with the better tools to talk about those things in a way that is compassionate, in a way that is answering a lot of questions, strength-based, and that reduces anxiety with a skill set that maybe a nurse or a doctor may not have, who isn't specializing in mental health. So specifically, psychology in hospitals, talking more about that. So like I said, we can do a lot of group different modalities, so group testing, and then psychiatrists, nurses, and PAs do medication management, opportunities for research, particularly in academic medical settings, somewhere like Nemours, Penn Hospital, CHOP, all of those places are embedded within are they publicly funded or embedded in a university? So there's a lot of opportunities for research. Christiana Care also does a ton of research. So it's really cool if you're interested in that because there's opportunities within the medical field to do research as well. And health psychology versus behavioral health. So health psychology is kind of what I was talking about earlier. So people who work in treatment adherence, or how does like my diet while as a person with diabetes affect my long-term wellness and my mental health, things like that. Versus behavioral health is more focused on things like depression, anxiety, and how does that affect me. So health psychology might be more focused on how my physical health is affecting my mental health or how there's like this intersection between um, a chronic illness that I have or an acute illness that I have, and the different ways in which my thinking around it or my operations around it affects me, affects other people, and how can we improve quality of life or different things versus behavioral health. It can range from a kid doesn't sit still, and how do we help them like sit still? And then it can include diagnosis, all sorts of things. So there's lots of different opportunities within even the medical field, either in pure behavioral health, which is more of what I do, or health psychology, which a lot of my colleagues do. There's a lot of opportunities for interdisciplinary collaboration, which I love. I get to go and just talk to my patient psychiatrist or nurse and say, like, hey, how have they been with you in the office? I saw they got a new medication. What's been going on with that? How has it been going? Or I can be like, hey, I know they got a new medication. It does not seem to be working. You're not going to see them for another 2 months. So I'm going to give you a heads up on that. And make sure that they talk to you about it. It's really cool to be able to like collaborate with, if I have a kid who's also seeing one of our other doctors for a chronic illness, I can reach out to their doctor and ask them like, hey, can we coordinate? Because it seems like they've been really stressed about this recent diagnosis or this new treatment or whatever it is. And maybe we can like put our heads together on how to support them. Um, and children's hospitals can be different from a general hospital because it's specifically for children, versus a general hospital might be more geared for adults. So that's another thing to consider too, is what population you want to work with, age group, what type of diagnosis, all sorts of things. And then finally, outpatient treatment. So I'll talk a little bit more just about like my role. So I'm a psychologist in the what we call YMAP, so specifically for adolescents, in the clinical child and community psychology clinic. So basically, we just see kids in the community. Um, Hospital-based and community-based behavioral health can sometimes provide similar services. Like what I do as an individual therapist, you could probably find in another private practice someone else doing as well. To me, one of the big benefits of seeing me at Nemours is we will take your insurance and we will pay for your services, or your insurance will pay for your services. That's not guaranteed all the time in community mental health and in private practice. So that's kind of at least one of the benefits, but I will say like lots and lots of amazing psychologists, therapists, psychiatrists doing their own private practice thing. So I don't know that the quality of care is different, but there may be some benefits to having it at a hospital-based setting. Especially, I think I have some patients who are medically complex, which means they have chronic health issues, chronic pain issues, and mental health issues, and maybe some other things on top of that. And so it's helpful for them to have all of their providers in one spot so they don't have to repeat their story to like 50 other people every other week. Um, so I see a lot of people across a wide range of mental health presentations. I do parent coaching, family therapy. I can see people across different medical conditions, that intersection of physical mental health, like I was saying. At Nemours, for example, we have specific clinics just for family therapy where parents learn the skills to help with their children who maybe are struggling to listen and uh, follow rules and maybe have a lot of like tantrums and are really struggling with managing their feelings. And the parents are frustrated and they don't know what to do. And then it provides a lot of like skills to parents for how to like manage their kids in a way that is healthy, helpful, strength-based, and positive. Um, we also have clinics that look at that intersection again between physical and mental health. So elimination disorders, kids who struggle to go to the bathroom or go to the bathroom too much or not at the right time. Feeding disorders, so eating disorders, anorexia, bulimia, but also things like ARFID. So if you have a sensitivity to certain textures, that prevents you from being able to eat in a way that other people can eat. That leads to growth issues or really limited in like the different types of foods. People with swallowing difficulties, autistic kiddos also often are in our feeding disorders clinics to help with eating because of texture sensitivities. And then neurodevelopmental disorders, things like ADHD, autism, um, cognitive delays, all sorts of things. And then you could go into private practice. That's where you basically just own your own business. You do everything independently. You are your own boss. Some people really enjoy that. I personally don't feel like that's for me right now because I really love being under a big system where I get to do research, train other people, and have a lot of other coworkers to talk to about my work. And there's a lot of collaboration. Okay, so that was a lot of information. I will open it up for questions. I think there might be some already, maybe.
Yep, you have
Yes.
some questions for sure.
Nicole, take it away.
Okay. So the first question we had was, what was your first job in a medical setting after you decided on a career in mental health?
Um, so funny story, being at Nemours is actually my first hospital job. Um, Medical setting probably was Terry Children's Center. That was the inpatient facility that I was at, and that included emergency care, emergency psychology care, psychiatric care, as well as long-term, like I had someone there who was there for an entire year. A lot of severe mental health difficulties. So that was probably my first like medical-ish. Other than that, I'd actually been in a lot more like school settings and community mental health settings.
Next question, I'll kind of combine two of them because people are asking about one, did you do any research internships or programs during high school that were helpful? And this follow-up question would be like, do you know if there are any open positions for that?
Great questions. I love where you guys are at trying to get ready for the future. So yeah, in high school, I was like thinking pre-med for college. So I did a lot of volunteering in hospital settings. I volunteered at the Ronald McDonald House, and really loved my experience there. It was amazing. It was just so fun, and there's so many different things you can do there. When I was I think you can also find, like, for example, hospice care. I volunteered in hospice care, and I think they will absolutely love people to just come and hang out and talk and spend time with them. And so that can be really rewarding because I think, like, even just a few hours of your day to, like, help people feel more, like, connected is really wonderful. So I think in high school, I did some of that. Like I had a mom who was very proactive, and I really am thankful to her for that because she was like, "Have you tried all these places? Are you applying?" And I was like, "No, I'm not thinking about any of it because I am 16." And she's like, "Well, anyway, I applied for you." So I think there's a lot of opportunities if you're willing to go out and look, and usually their websites will have like, "Do you want to volunteer with us?" And then you can like put out your application. So Nemours has them like the Ronald McDonald House, but I think a lot of maybe Christiana, I'm sure, has them too. And then there's also sometimes like your larger like uh what is it, retirement facilities or other facilities that really would absolutely invite volunteers to come. In college, for internships, I did a lot of research stuff. In undergrad, throughout the school year, I would do research, and that you can either just cold email people who have labs. Like the benefit of going to a big university like UD, University of
Yeah.
Michigan, UPenn, wherever, is that there are 1,000 people doing research in almost every possible subject. And so if you know something you like I'm really interested in oncology research, I'm interested in hematology, I'm gonna go find someone who's doing that. You could just cold email them and say like, "Hey, you want someone in your lab? I will do anything." And usually they'll be like, I mean, if it's for free, yes, absolutely.
Yeah,
Um,
for free is caveat.
yeah, but then there's also like work study too. So
Sure.
like if
Yeah.
I got through a grant like a little bit of money for work, and so they'll list job opportunities where they're like, we just need a research assistant to come in and help like pipette or like make sure that all of our participants are signing the release of informations for us, or to like interview people, and we'll pay you like $10 an hour to do it for like 10 hours a week, and you can do those too. So your school's job website, as well as just cold emailing people, are a really great way to get your foot in the door with research. And once you have at least a couple of credits, like things on your resume, then you can apply for better jobs because they can be like, "Oh, you've done something, thank God." And then for the summer, usually, then that gives you a time to apply for a lot of internships too. I did something called the REU, Research Experiences for Undergraduates. I believe that is funded by NSF. And that was a really great opportunity. So universities across the country provide RU experiences in different types of fields, and you can apply for them, and it's fully funded. They will fly you out there. Usually, it includes room and board, and that's a great opportunity and something I did junior year of college. But you can also apply for other types of internships too. So those are
Yeah.
some of the things I did in undergrad.
Yeah, I will also say early on when you're talking about your kind of path to go through education, you took a break and you notice all your friends were burnt out and you're like, I need a break too. I actually really appreciate that you mentioned that because I think that sometimes gets overlooked. A lot of people have this idea in their head, they're like high school, undergrad, graduate, or medical school, like they feel like they have to go boom, boom, boom. But sometimes you kind of have to figure out what's best for you and your overall health. And that's kind of what I even did. I'm actually starting grad school at UM this fall. So, and I took the same thing. I took 3 years off before I went back to school. So I appreciated you mentioning that because I think people overlook that part.
Yeah, absolutely. I mean, if it's not for you, amazing. You have the stamina, like go
Yeah,
for
yeah,
it. But
exactly.
also, like, what's 3 years? By the time you finish, like, your thing, you're still young. Like,
Yeah,
I think sometimes there is this, like, go, 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 keep going, don't stop, momentum. And I think if you lose momentum after taking a break and don't go back to grad school, then maybe you didn't really want to go to grad school, and it's probably a good thing that you didn't spend like $200,000
right.
doing something that you were like, my God, what am I doing with my life? Because I think if you really want it, you will go back because you're going to be
Right.
like, I am bored doing this. It was fun for a couple of years, but now I'm like, okay, on to the next thing. I'm ready to learn. I am ready to advance, progress, and that requires another degree. And I know that was the case for me. Like, I never saw myself being a lab technician at DuPont forever, but it was a good way for me to get research experience, learn about how I function, figure out exactly what I want to do with my career. And then after that, I absolutely was not going to get deterred, even by multiple rejections, for the things I applied to. So I think if you want it, you will go back. If you didn't really want it, then you might not, and
Yeah.
that's probably okay.
So now we can kind of shift into more the career side of things. So when you were addressing the different type of work settings that you can work in as a psychologist, is it possible to work in multiple settings at one time, and can you also work remotely?
Yeah, so there's remote work for sure, especially I think if you're like for some of our psychologists do a lot more like they may not do long-term therapy. It's more like a couple of check-ins every other like every month or so or every other week. A lot of that can be done virtually and in fact might be encouraged, especially if you have people who are limited mobility wise, who are disabled, who really struggle to get out of their house because of different things. Some people just income wise like we have patients who live all the way down in like Seaford. They're
Yeah.
not driving up all the way to Nemours for their appointments unless they have to for a surgery. So there's definitely opportunities for virtual. There's also for in-person, and we absolutely have people who might occupy multiple areas of expertise. So you can definitely do that. I think it depends on like you wouldn't want to do too many things because like part of it is specializing so you really know something really well. But there are like for myself, I specialize in something called DBT, dialectical behavior therapy, and that's a very specific therapy that's like pretty involved. It is a whole like thing in and of itself. But I also specialize in trauma therapy, so trauma focused CBT. So you can definitely have multiple specialties, and then it just depends on your interests. If you're a big learner, nothing's stopping you from being
Yeah.
able to do lots of things.
And this question was, oh, also, our session will be done technically at 1 p.m., but you can stay on for additional Q&A if you would like. I will probably be hopping off at 1, but Tim will still be here. Yeah. So I guess my last question, but Tim can still go after that. Do you personally enjoy working more in the hospitals or in schools, and why?
Um, I think that I prefer right now, I like where I am at the hospital, because I get to do lots of different things. So, um, I can do research, I can train other people, I can do the individual therapy that I'm really passionate about. So I like that. But other people like schools more because they really like being able to directly talk to a kid's teacher and their nurse and their principal and coordinate care with them and collaborate in that way. Or the specific interventions around educational stuff is a passion of theirs. There's an entire, I didn't even talk about this, there's an entire degree for school psychology. So you can do that. And our school psychologist at Lehigh, the school psychology program at Lehigh is actually really good. And they don't just do school psychology, they're actually really strong in pediatric psychology too. So in children's hospitals. So I think everyone has a different thing. For me, I prefer being at Nemours. I think what I get to do there is very perfect for me. But other people love the school setting.
Well, thank you so much. I'm going to hop off, but Tim's still going to stay on for further questions. Thank you so much for joining us.
Thank you, Nicole. Alrighty, so can you describe an average day in your work?
Yeah. So let's see. I mean, because like I said, I do kind of different things. I'll talk about an average week. So Mondays are usually my research days. So I'm working on a lot of grants right now to try and get some research projects off the ground. And then my clinic days, so when I see patients, are Tuesdays, Wednesdays, and Thursdays. And the most people I see in a day is 7 people. So I will see 7 patients for about 7 hours in a day, where I talk about different things that range from anxiety to depression to trigger warning, like thoughts of wanting to die, self-harm. Sometimes we might talk about family issues. We'll talk about friend issues, the future, college, career. What do I want to do? I don't know, and that's okay. And then starting in July on Thursdays, I'll be observing one of my trainees. They will be a someone in a doctoral program for psychology currently, and I will just observe their sessions. They're going to do their sessions, and I'm going to watch them from behind a glass, like a creep. And that helps with their training, so I can give them feedback, and they feel more comfortable because it's like, okay, someone has my back, and I'm not just like free floating. Um, so I'll do training, and then I also uh there are some medical students coming to observe my work. So that's another part of the training I'll be doing, is letting other people observe me. So the clinic days I see patients, and then I also train other people. So that's like a typical week.
Alrighty. Just scanning down through these. Uh, did you mention therapy for babies and very young children? If you did, can you tell us a little bit more about that?
Yeah. So usually with so for example, you can do testing with babies. You can diagnose autism as young as like 2 or 3. And so some of that is testing, some of it is usually because they're so young, they're not going to be able to tell you what they're feeling. So a lot of it is more family therapy and parent coaching. So you might have issues like toileting or feeding or sleep, um, or things like behavior. So my kid really struggles to listen, they're really hyperactive. It's really hard for them to follow directions. Maybe they don't remember things really well, and the parent is getting really frustrated and they don't have the skills to figure out what's going on and how to like get peace back in their home. So then our ABC clinic, for example, PCIT is another type of therapy that's specific to this. We at in our clinics, of those 2 clinics, they work to give parents the tools to help them help their kids. So it's in some ways more parent therapy, but it's parent therapy for parents with young children.
All right. Um, do you think that this is such a timely question? Do you think that AI will have a significant impact on jobs as psychologists, psychiatrists?
So yeah, actually at Nemours, we are using Copilot, which is the AI that Microsoft has created. And it's a tool that is being offered to people who want to use it to help them with notes. So typing out notes. Some people struggle with notes. Like you got to do one for every person. And if you see 20 people in a day, that's a lot of notes. And so the AI can be a tool for good. If it's helping you get your notes down, you can just narrate it while you're doing other things. You don't have to sit there and type it, so that you can get things done and quickly, and make it can make your work more efficient. Other people are using it for report writing, which could be okay or not okay, because if you're not then going back and making sure it's like they might fill in the key information, the AI, but we as clinicians go back and then go, all right, well, the information's in. Now I can like add my actual interpretation of what's going on and the important narrative outside of just the raw data that needed to be put in. Um, I I will say my own bias. So please, like huge, giant, like whatever. My own bias is like I don't use AI, but I will say I'm privileged in that I am an extremely fast typer. I do not need it. I can literally just, as you're talking, I will type out everything you're saying, like a court transcriber. But not everyone is like that, and so I think some of my coworkers really benefit from having something that can type it out for them. But it's something you need to make sure that because the ethical issue is if you're just copy and pasting things and you're just letting a machine interpret for you, the machine is not as advanced as a human brain and interpreting things like diagnosis, disease, medication, none of that. But it can be a useful tool for people who struggle to just like get brain to paper.
Right, right. So you mentioned that Mondays is your research day, I think. Does the research that you do have to be medical or health related?
No, mine is not because that's not my specialty. I'm not a health psychologist. My other peers at Nemours, a lot of the research at Nemours is health psychology related, but mine is not. So I'm really interested in how interventions can get carried over into diverse populations in a way that is culturally responsive. So, something that I'm trying to do is get funding to do DBT, dialectical behavior therapy, at the Ferris School, which is the maximum security boys treatment center up in Greenville, and to see like how we can use that intervention to help improve skills, reduce certain problematic behaviors, and hopefully increase their success in the community once they leave Ferris. And so a lot of my research is around like, how does this intervention work with this particular population? Is it effective? If it's not, what do we need to do to adjust it? And then how can we like continue with that? Or looking at, okay, are doctors screening appropriately for high risk behaviors? And if they're not, what is it and what training do we need to help support them so that they feel like they can more confidently do that work? Um, so things like that. Mine is not particularly in health psychology, so it doesn't have to be.
Right. So there are a couple of questions about shadowing. The first question is, did you ever shadow a physician or other degreed provider? And then the other question is, in your particular field of work, due to confidentiality, is shadowing even a possibility?
I don't think so for high school students, at least not at Nemours. I don't know about private practices because those people are basically their own bosses. They can not do or do like most things underneath of like ethical stuff. But at Nemours, no, you have to at least be an undergraduate to be able to shadow stuff. We have undergraduate research assistants that go through UD, so they can shadow, and they do also help with research things, and like helping set up clinical stuff. Um, but I don't think we have anything for high school students, but private
Yeah.
practices might be different. I was able to shadow like physicians in physicians' offices when I was in high school, like your primary care doctor, things like that. But I think sometimes in mental health, it's a little different. Sometimes people are disclosing really private information, and so uh, they might be more likely to say no.
All righty. Here's a good question. How do you differentiate between psychological disorders and neurological disorders?
Probably testing. That's what I typically recommend. So, for example, something really simple like, are you anxious or do you have really bad undiagnosed ADHD? Do you have social anxiety or are you autistic? And how do you figure that out? You could do thorough interviewing. That's the skill sets that people like psychiatrists or psychologists have. But at the end of the day, especially if it's a neurological thing, like okay, is this person forgetful or did their traumatic brain injury from 2 years ago like really severely mess up their like somewhere in here that allows them to encode things into long-term memory? That's a thing that psychological testing will be able to do, neuropsych testing. And I've done some of that where people are like, I don't know, maybe I'm just forgetful. And you're like, oh, actually, your brain just does not remember things in the long term. Like That's weird. Did you know that? They're like, no, I didn't know that. So I think, yeah, psychological testing, neuropsych testing,
Uh,
comprehensive psychological testing.
and this is one of the two sides of the same coin. What is the hardest challenge you faced in your career? And on the other side, what do you love most about your job?
I think
Which
the
could be
most,
one and the same.
yeah, no, sometimes it's the same thing. Some of the things that I find really challenging are also the most exciting. Um, I work primarily with kids and families, and I think that sometimes getting everyone on the same page, helping everyone understand each other in a really deep way, can be really challenging because everyone's kind of trying to get heard and they're trying to be seen and they're trying to be understood. But sometimes that means it makes it really hard to put that down to understand someone else. And it can be frustrating for everybody when it's not happening. And um, that can be really challenging, but it's also really rewarding to try and really figure out, like, all right, I'm like the mediator here in the middle. Like, how can we get us all on the same page? Because at the end of the day, I think for most people, the goal is that I love my child and I want them to be better and I want them to be happy and successful. But how do I like get myself into a space where we can make that happen? So it's both frustrating, but also extremely rewarding and interesting and sometimes fun. Yeah.
Right. All right. Um, Alfred asks, how does someone who is a psychologist also manage their overall health while dealing with patients' health at the same time?
Yeah, that's a really good question. By being self-aware. I think this is, I'm not gonna lie, I think this is probably a problem for many people in the health profession, in the helping profession generally. People who are really good at being helpers are not always like making space for themselves. And so I think it's really important, and this is something I talk about with my learners a lot, is be self-aware. That's like the first thing I said is fail and be cool with failing. Say you're tired, say you're burned out, say you are like, I am so sick of these people right now. Like, what's wrong with me? Oh, if I'm starting to get annoyed with my patients, I think I might be burned out and I need a vacation. Being self-aware, being willing to admit, like, I think I need help. Maybe I need to go see my own therapist. Maybe I need to talk to my boss about taking some time off. Maybe I need to go and talk to my colleagues. Some people feel embarrassed. Like, I can't tell my coworker that I'm struggling. They're going to think I'm like bad at my job. Hopefully you have the kind of coworkers who are not going to judge you on that, because if they do, then they suck. I happily talk to my coworkers like, man, I've been really struggling with this case and I feel like I dread every time I have to talk to them. And they can give me really good advice. And then I feel much better because I'm getting supported, getting good advice, getting good consultation on how to move through that. But if you don't ask for help because you're not willing to admit that you need help, then that's probably the biggest problem.
All righty. Three questions left. Jennifer would like to know, please tell us a little bit about your experience at UPenn.
I was there for a master's, which I think is very different from undergrad. I think as an undergrad, there's probably a kind of pressure that is not the same as when you're like an adult. Um, and at least for me, and that's why I think maybe take a break if you need to. I had 4 years under me. I was 25 when I came to UPenn, so I was kind of like able to block out the noise and not put pressure on myself about things. I was like, I'm here to like learn, and it's whatever. Who cares? Um, But I think that when graduate students have a very different experience of a school than an undergraduate. Um, Both in the sense that you don't feel as connected sometimes because there's a lot of stuff that they give to undergraduates to help you feel part of a community that graduate students don't get. And so that's really cool when you're an undergrad. Like there's tons of activities, social events, supports, tutoring, and lots of things. It's really amazing that graduate students don't necessarily also get. But I also think in some ways, like as a graduate student, you're older. So a master's degree is so focused. Like you basically learn the same thing for 2 years versus an undergrad, you have general education credits, you have all these other things. Like it can be kind like I think some of the big differences are both how concentrated a master's degree is versus undergrad, the level of like support you get as a graduate student versus undergrad, and also I think where you're at in your life as like someone in your mid 20s versus someone who's like in your late teens.
Right, right. And Curtis asks, What would you tell yourself in the past to increase your chances of success during pre-med or in the future?
Um, Figure out how to study. Uh, I think I did really well in my psychology classes and not so well in my pre-med classes, which was, I think, also another sign that I was meant to be a psychologist and not a psychiatrist. That might be different from for you guys. Like some of you might be really good at science, so then you're gonna be like, yeah, pre-med classes, amazing, so fun. I just don't think I was a kid who was really good in high school. Like I got straight A's, I was valedictorian. It wasn't hard. And then I got to Michigan in the honors program, and I was like, oh my God. Uh, I don't know how to study. Nothing is being retained. What am I even doing? Time management was absolute garbage. And being in college is really fun. So I think I had a lot of fun, and wasn't always putting my nose to the grindstone a little bit. So I think something that will be help with success is learning your learning style, how you study, how you retain information, and how you manage your time so that you can enjoy your time at college, but also still stay focused on like the goals you have for yourself. And some people that means study groups. Lots and lots of tutoring, study opportunities in colleges, lots of resources, taking advantage of that. Taking advantage of your friends, if that's your thing, like engaging in study groups with your friends. Go in to talk to your professor. They offer office hours for a reason. I never used an office hour. I don't know why I did that. I think as an undergrad, I was very bad at admitting that I needed help. So that's probably a thing I would tell myself, like just go to office hours. Um, Especially because if you go to office hours, the professor knows you better. They will write you a much better recommendation letter. So go to office hours.
Alrighty. And even though another question came in, technically this is the last question. Did you join in various clubs and organizations which kind of burned you out during high school? Because you did mention you were doing a lot of things, or were you more laid back and preparing yourself for undergrad and graduate school?
Um, I did a lot of stuff in high school and I was fine with it. I was not burned out. But I did nothing in undergrad. But I think it's because I had a full schedule. I double majored, so this kind of answers this other question. I double majored in biology and psychology, and then I was also pre-med. So I pretty much had to hit a lot of different requirements. So I was having a full schedule every single semester. So I really didn't do any after school, like I didn't really do any extracurriculars. Which in hindsight would have been nice because colleges have so much stuff. It's like super cool. There's just so many things you could get involved in. And I did almost none of it. I did a lot of research. That was my main extracurricular. Um, so I think in some ways college burned me out more than high school. High school was like fine. But then college really burned me out because I was so packed academically. And I think that you probably don't need to do that. Like maybe just minor in something. Like you don't have to like double major. It's really does not matter. It's fine. Yeah.
Yeah, yeah. All righty. Well, next week we are going to have neurosurgery presented by Tidal Health. And just to remind everybody that the day of the week is different often. So next week it's going to be Tuesday. Doctor, thank you very much for an excellent kickoff to our summer mini med. Have a great week, everybody. Bye bye.
Thank you. Bye.